Hello dear friends, today we talk about diabetes. Type 1. Type 2. Sign and symptoms. Causes. Diagnosis. Tests. Complication. Treatment. What is diabetes? Diabetes happens when your body isn't able to take up sugar, glucose, into its cells and use it for energy. This results in a buildup of extra sugar in your bloodstream. Mismanagement of diabetes can lead to serious consequences, causing damage to a wide range of your body's organs and tissues including your heart, kidneys, eyes, and nerves. Why is my blood glucose level high? How does this happen? The process of digestion includes breaking down the food you eat into various different nutrient sources. When you eat carbohydrates, for example, bread, rice, pasta, your body breaks this down into sugar, glucose. When glucose is in your bloodstream, it needs help to get into its final destination where it's used, which is inside your body's cells. Cells make up your body's tissues and organs. This help or key is insulin. Insulin is a hormone made by your pancreas, an organ located behind your stomach. Your pancreas releases insulin into your bloodstream. Insulin acts as the key that unlocks the cell wall door, which allows glucose to enter your body's cells. Glucose provides the fuel or energy tissues and organs need to properly function. If you have diabetes, your pancreas doesn't make any insulin or enough insulin. Or, your pancreas makes insulin but your body's cells don't respond to it and can't use it as it normally should. If glucose can't get into your body's cells, it stays in your bloodstream and your blood glucose level rises. The types of diabetes are: Type 1 diabetes. This type is an autoimmune disease, meaning your body attacks itself. In this case, the insulin-producing cells in your pancreas are destroyed. Up to 10% of people who have diabetes have type 1. It's usually diagnosed in children and young adults, but can develop at any age. People with type 1 diabetes need to take insulin every day. This is why it is also called insulin-dependent diabetes. Type 2 diabetes. With this type, your body either doesn't make enough insulin or your body's cells don't respond normally to the insulin. This is the most common type of diabetes. Up to 95% of people with diabetes have type 2. It usually occurs in middle-aged and older people. Your parents or grandparents may have called it prediabetes. This type is the stage before type 2 diabetes. Your blood glucose levels are higher than normal but not high enough to be officially diagnosed with type 2 diabetes. Gestational diabetes. This type develops in some women during their pregnancy. Gestational diabetes usually goes away after pregnancy. However, if you have gestational diabetes, you're at higher risk of developing type 2 diabetes later on in life. Risk factors for type 1 diabetes include having a family history, parent or sibling, of type 1 diabetes. Injury to the pancreas, such as by infection, tumor, surgery, or accident. Presence of autoantibodies, antibodies that mistakenly attack your own body's tissues or organs. Physical stress, such as surgery or illness. Exposure to illnesses caused by viruses. Risk factors for prediabetes and type 2 diabetes include family history, parent or sibling, of prediabetes or type 2 diabetes. Being Black, Hispanic, Native American, Asian American race or Pacific Islander. Having overweight/obesity. Having high blood pressure. Having low HDL cholesterol, the good cholesterol, and high triglyceride level. Being physically inactive. Being age 45 or older. Having gestational diabetes or giving birth to a baby weighing more than 9 pounds. Having polycystic ovary syndrome. Having a history of heart disease or stroke. Being a smoker. Risk factors for gestational diabetes include family history, parent or sibling, of prediabetes or type 2 diabetes. Being African American, Hispanic, Native American or Asian American. Having overweight/obesity before your pregnancy. Being over 25 years of age. What causes diabetes? Causes of type 1 diabetes. This is an immune system disease. Your body attacks and destroys insulin-producing cells in your pancreas. Without insulin to allow glucose to enter your cells, glucose builds up in your bloodstream. Genes may also play a role in some patients. Also, a virus may trigger the immune system attack. Cause of type 2 diabetes and prediabetes. Your body's cells don't allow insulin to work as it should to let glucose into its cells. Your body's cells have become resistant to insulin. Your pancreas can't keep up and make enough insulin to overcome this resistance. Glucose levels rise in your bloodstream. Gestational diabetes. Hormones produced by the placenta during your pregnancy make your body's cells more resistant to insulin. Your pancreas can't make enough insulin to overcome this resistance. Too much glucose remains in your bloodstream. Symptoms of diabetes include increased thirst, weak, tired feeling, blurred vision, numbness or tingling in the hands or feet, slow healing sores or cuts, unplanned weight loss, frequent urination, frequent unexplained infections, dry mouth. Other symptoms. In women, dry and itchy skin, and frequent yeast infections or urinary tract infections. In men, decreased sex drive, erectile dysfunction, decreased muscle strength. Complications include cardiovascular issues including coronary artery disease, chest pain, heart attack, stroke, high blood pressure, high cholesterol, atherosclerosis, neuropathy, kidney damage, kidney failure, eye damage, retinopathy, cataracts, glaucoma, foot damage, skin infections, erectile dysfunction, hearing loss, depression, dementia, dental problems, complications of gestational diabetes, preeclampsia, hypoglycemia. Diagnosing diabetes. There are 3 tests that can measure your blood glucose level. Fasting plasma glucose test. This test is best done in the morning after an 8-hour fast, nothing to eat or drink except sips of water. Random plasma glucose test. This test can be done anytime without the need to fast. A1C test. This test, also called HbA1c or glycated hemoglobin test, provides your average blood glucose level over the past 2 to 3 months. This test measures the amount of glucose attached to hemoglobin, the protein in your red blood cells that carries oxygen. You don't need to fast before this test. Oral glucose tolerance test. In this test, blood glucose level is first measured after an overnight fast. Then you drink a sugary drink. Your blood glucose level is then checked at hours 1, 2, and 3. Gestational diabetes tests. There are 2 blood glucose tests if you are pregnant. With a glucose challenge test, you drink a sugary liquid and your glucose level is checked 1 hour later. You don't need to fast before this test. If this test shows a higher than normal level of glucose, over 140 ml/dl, an oral glucose tolerance test will follow, as described above. Managing diabetes. Keep your blood glucose levels as near to normal as possible by following a diet plan, taking prescribed medication and increasing your activity level. Maintain your blood cholesterol, HDL and LDL levels, and triglyceride levels as near the normal ranges as possible. Manage your blood pressure. Your blood pressure should not be over 140/90 mmHg. How is diabetes treated? Type 1 diabetes. If you have this type, you must take insulin every day. Your pancreas no longer makes insulin. Type 2 diabetes. If you have this type, your treatments can include medications, both for diabetes and for conditions that are risk factors for diabetes, insulin, and lifestyle changes such as losing weight, making healthy food choices and being more physically active. Prediabetes. If you have prediabetes, the goal is to keep you from progressing to diabetes. Treatments are focused on treatable risk factors, such as losing weight by eating a healthy diet, like the Mediterranean diet, and exercising, at least 5 days a week for 30 minutes. Many of the strategies used to prevent diabetes are the same as those recommended to treat diabetes. See prevention section of this article. Gestational diabetes. If you have this type and your glucose level is not too high, your initial treatment might be modifying your diet and getting regular exercise. If the target goal is still not met or your glucose level is very high, your healthcare team may start medication or insulin. Diabetes medication drug classes include sulfonylureas. These drugs lower blood glucose by causing the pancreas to release more insulin. Glinides, also called meglitinides. These drugs lower blood glucose by getting the pancreas to release more insulin. Biguanides. These drugs reduce how much glucose the liver produces. It also improves how insulin works in the body, and slows down the conversion of carbohydrates into sugar. Alpha-glucosidase inhibitors. These drugs lower blood glucose by delaying the breakdown of carbohydrates and reducing glucose absorption in the small intestine. Thiazolidinediones. These drugs improve the way insulin works in the body by allowing more glucose to enter into muscles, fat and the liver. GLP-1 analogs, also called incretin mimetics or glucagon-like peptide-1 receptor agonists. These drugs increase the release of insulin, reduce glucose release from the liver after meals and delay food emptying from the stomach. Insulin medications. Rapid-acting insulins. These insulins are taken 15 minutes before meals. They peak, when it best lowers blood glucose, at 1 hour and work for another 2 to 4 hours. Short-acting insulins. These insulins take about 30 minutes to reach your bloodstream, reach their peak effects in 2 to 3 hours and last for 3 to 6 hours. Intermediate-acting insulins. These insulins reach your bloodstream in 2 to 4 hours, peak in 4 to 12 hours and work for up to 18 hours. Long-acting insulins. These insulins work to keep your blood sugar stable all day. Usually, these insulins last for about 18 hours. There are insulins that are a combination of different insulins. There are also insulins that are combined with a GLP-1 receptor agonist medication.